Hi, this is Dr. Justin here. Today's talk is going to be on exercise. What's the best kind of exercise I can be doing to burn the most amount of fat, look good, and perform well? This is a question I get that runs across my desk multiple times per day. And seeing many patients that are trying to optimize their body composition, I've studied this topic and I apply it and use it in my life daily. So in regards to the exercises that I recommend, first thing we should look at, what exercises shouldn't you be doing? So I see many people that are into marathon running or doing triathlons and various long distance aerobic types of exercises. Now if you enjoy these exercises and you're in good health and you have no health complaints, that's fine, that's one thing. But I see many people that are going to those exercises to actually improve their body composition. And those exercises for the most part are very oxidatively demanding, meaning they create lots of free radicals, which can damage DNA. And two, they stress your adrenals out. They make a whole bunch of cortisol and actually break down lean tissue and break down lean muscle. Being a chiropractic physician as well, I treat many patients with chronic injuries that do these types of events, that do the marathon and the long distance aerobics. So I strongly recommend that's not the best way to change your body composition and to get optimal health. If you enjoy it, that's one thing, but a lot of people are just doing it because it's ubiquitous. Everyone's running and doing all these different things, and they think if I do it, I'll benefit just like they did. And that usually isn't the case. So the type of exercise I recommend is interval or burst training. We recommend body contouring burst training, where we start at a certain level of intensity to get loose. We increase the intensity for about 30 seconds at a maximal effort, and we then come off that and do about a 90-second rest and recovery. We do that back and forth about 8 times, and then follow it up with about a 3-minute cool down. And what this is doing, the ups and downs and the short duration, is actually increasing a hormone called growth hormone. And many people actually spend $2,000 to $5,000 a month on growth hormone injections, but by doing the right exercise, you can actually stimulate growth hormone production. And when we look at long distance aerobic exercise, once you hit past that 40-minute threshold, we're seeing an increase in the hormone cortisol and more stress hormones and more adrenaline being produced. And one of the main reasons why people tend to conduct these exercises is that they hit the wall at some point, or they get this runner's high that's usually a spike in beta endorphins, which are natural antidepressants. So again, when we recommend and when we look at exercises, we have to look at the hormonal implications of these exercises. And the hormones we're making with long distance aerobic exercise tend to be hormones that break us down, that actually weaken our metabolism over time and cause an increase in oxidative damage, which essentially means damage to our DNA. And the exercise I'm recommending are short duration, high intensity types of movement patterns to help increase growth hormone and to actually help bring down cortisol. Outside of that, resistance training can be very beneficial, especially if you're doing functional movement patterns such as bending or squatting or lunging or pushing or pulling or twisting and or walking as well. It's important that you're using good form with these movements because poor form can actually cause increased injury, which means more and more cortisol, which is not good. So the key takeaway from this video really is working smarter is actually better than working harder. And actually in trying to add in some of the burst or interval training into your workout and cutting down some of the long distance aerobic training can improve your body's ability to burn fat and help put on nice lean muscle. For more information, feel free to visit justinhealth.com and or email or call the office. Thanks. Have a great day.